Hi, everybody. My name is Mark Lubkowitz. Welcome to Lub Goes Live. I'm a professor at St. Michael's College in molecular biology, and I've been making videos for the St. Mike's community and really for anybody who's interested in science on COVID-19 and really other science stuff as well. So I ran across a paper that has really shaped the way that I'm viewing the modeling that we're all reading about. And this paper really explains why it's so important to understand two parameters. And that is, how long does immunity last after you get COVID-19? Are you resistant for a little while, for an intermediate period of time, or a long period of time? And then the second parameter that this paper goes into is understanding why it's so important to understand the seasonality of it. So right now we don't know is COVID-19 going to be like other coronaviruses, the ones that cause the common cold that come and go, they wax and wane. There's a cold and flu season typically in the winter. Or is the coronavirus going to be one of those viruses that it sticks around the same period of time and doesn't go away? And understanding which of those scenarios it is going to inform public health policies quite a bit, as you'll see in this paper. Okay, without any further ado, let's look at some science. All right, so there we go. As always, whenever I look at a science paper, I like to start off by asking myself, where was it published? If you've seen other Lub Goes Live, you know that Science is the top tier journal along with Nature. This paper was published in Science, has a very high bar for peer review. The work was done by the Lipsitch lab, which is one of the head epidemiology labs at Harvard. So these are the big guns. All right. So they asked a couple different questions. So they said, we know quite a bit about coronaviruses that cause the common cold. So can we use that as our basis for our model? So there are two very common coronaviruses, which you've probably all had, which I'm just going to call the blue and the red. They have some other names. They circulate throughout the human population. They're seasonal. They appear during cold and flu season. And interestingly enough, you can't get them at the same time. So if you get one of them, you have partial immunity to the other for about a year, which is why you see like red low here and blue high there. So if you look at that, here's the cold and flu season. It comes and it goes. It comes and it goes. It comes and it goes. So it waxes and wanes in a pattern that we are all familiar with. All right. This line right here is when COVID-19 shows up in our species and starts circulating. This black line is the current pandemic that we're in. And they asked the question, what would future outbreaks look like, assuming that after you've had COVID once, you're resistant for about 40 weeks. You get 40 weeks of immunity. And essentially, it would follow the same sort of pattern as the cold and flu season. So every winter, COVID would show up along with the common cold, and that would go away in the summertime. Next, they asked the question, well, we don't actually know how long immunity is going to last. Maybe it'll be 40 weeks, maybe it'll be 2 years. So what would that curve look like if you actually had longer than 40-week immunity? Let's say 2 years. So once again, they modeled it using these other coronaviruses. Here's our current pandemic. When enough of us have immunity, the numbers drop down really low. 2 years later, it comes back. Notice it's not as large of an outbreak as it was before. Then we have an off year where we have a small bump, then a big year, then a small year, then a big year, then a small year. So we would enter into this sort of pattern of on, off, where the off years doesn't go away, but it's not nearly as bad as during the on years. Then they asked the third question, which is the one that we all hope for, which is permanent immunity. It's like smallpox. You can only get it once and then you're done, one and done. All right, so here's our current pandemic. And the model says after enough of us have resistance, over 5 years, it would just disappear from our species. And of course, that's what we all hope happens. All right, so these three figures here really drove home to me the importance of understanding how long immunity lasts, because they're three different models, and we will have to respond very differently to each depending upon which one is true. And of course, we won't know, well, for a while until we actually get 40 weeks or 2 years ahead. Next, they asked the seasonality question. So remember, there's two possibilities here. COVID is prevalent throughout the year. That's the first thing we're going to look at. And then the second option is COVID appears seasonally, corresponds with cold and flu season. So let's just pretend, so the model is based upon what if COVID is available all year long. And what they're going to look at now is how well does social distancing work, assuming that COVID is around all the time. So down here, we're going to have prevalence. So this is how many people are getting it. Here, we're going to have time in months. The blue bar represents a quarantine period. So this is a very small quarantine period. It's only 2 weeks. There's a lot of data on this figure. Let's just focus on the solid lines. The dotted lines represent patients that are in critical care, but let's just right now focus on the solid lines. So the black line is going to be our control. This is the worst case scenario. Nothing worked. We didn't do anything. And then the other ones, the green line is the quarantine worked great. We took the R naught, that is the rate at which it's being spread around. We lowered it by 60%. Okay, so that's a pretty big cut. The blue line represents we cut it pretty well. We cut it by 40%. And then the red line is, yeah, it didn't really work so well. We cut it by 20%. So it's sort of like the Goldilocks scale for it worked really well, it worked pretty well, didn't work so well. And what you'll notice is, I would say these curves compared to the control, they're not flattened, right? All that we've really done is just shift them to the right. And you can see that in the second figure, which I actually think shows it better. So once again, we have months down here. This is the total number of people that end up in critical care. So you expect it to go up over time. Once again, black is the control. So that's how quickly you reach saturation of total number of people in critical control. And notice when you do your quarantine really well, kind of well, and not that well, all you've done is delay the inevitable by a couple of weeks, assuming that your quarantine was 2 weeks. Okay, so that's maybe not that surprising. 2 weeks isn't that long of a period. So then they asked, well, what happens if you did quarantine for 4 weeks, for 8 weeks, for 12 weeks, and for 20 weeks, and then for in perpetuity, never left your closet? And so I'm not going to show you all that data, but I will show you the 8-week data because it points out the trend that they discovered, and it's about the amount of time that most of the U.S. has been under lockdown. It's certainly the amount of time that Vermont has been under lockdown. So once again, the blue bar here, this represents 8 weeks. This is how long we've been in quarantine. Okay, this is time in months. This is prevalence. Remember, black is going to be the control. So this is the worst case scenario. So let's start off with the quarantine worked really well, 60% reduction in transmissibility. That's going to be a green line. And look at that flat curve right here. Remember, black is the control. Squash, squash. There it is, flat line. We all celebrate, we break quarantine, and boom, it comes right back. Okay, so that's sort of scary right there. So if it's if it doesn't follow seasonality, if it's available all the time to affect people, according to this model, if you squash it, as soon as you break quarantine, it comes roaring back. Now, here's the part that blew everyone away. It certainly blew me away. I'm still trying to process it and figure out what it means. But remember, the blue line is your quarantine was moderately effective, right? So it only reduced transmission by about 40%, or not by about 40%. Notice once again, you flatten the curve from up here down to here. You break quarantine, you get another outbreak, but notice the outbreak is not nearly as bad as this scenario right here. And it's really counterintuitive because the green line, remember, is the green line. You did it right. You lowered the R naught by 60%. But then when you break quarantine, you get a big bump. And this is even more pronounced in the 12-week and the 20-week data sets. And what they think happens is essentially quasi-herd immunity. You don't have enough people resistant here. And so when you break quarantine, you essentially go back to where you started. And you can see that really, I think, really clearly in this second figure. So remember, this is the total number of people that are in critical care over time. Black is our control. Let's start with green. Remember, this is like you did it right. You lowered it by 60%. So here's the flattened curve. You break quarantine, you're breaking quarantine right here, and boom, here's your second wave. And notice your second wave peaks almost at the same point as if you had done nothing. Okay, that's sort of interesting. This is the one that I find really fascinating. So this is the intermediate effectiveness. So you lowered the R naught by 40%. You flatten the curve, not nearly as much as here, but you did flatten the curve. But notice your total number of cases is actually lower than your best case scenario for lowering your R naught. That was really unexpected. Okay. Third case scenario, and this is really a control. No one's proposing that this be done. This is the, as I like to call it, lock yourself in the closet for in perpetuity. It's the who was it? Was it Rapunzel that was in the tower and couldn't get out? So you're playing Rapunzel essentially. All right, so you can probably imagine if you lock yourself down for in perpetuity, you're going to flatten the curve. In all three scenarios, not nearly as well, but they will all come down. And you can see that really clearly here. So remember, this is total number of cases. Here's time. Here's the control. You did your quarantine really well. You flattened the curve. You did it moderately well. You moderately flattened it. You didn't do it so well. You didn't flatten it so well. All right. So take-home message is, in the absence of seasonality, it's complicated. Like it's really complicated on managing public health. But what if it is seasonal? Okay, what if COVID-19 appears and disappears with the seasons like other coronaviruses do, or even like the flu does? How might that affect these curves? Okay, so these are the exact same figures, but now we're assuming that the virus is seasonal, right? So it appears during the flu and cold season. So here's a 2-week quarantine again, right? And then remember, black is our control. Green is like we did the quarantine well, blue is we did it okay, and red is we didn't do it that well. Notice in all scenarios, though, you're flattening the curve, and the better you do the quarantine, the flatter it gets. And you can really see that here in total number of cases that end up in the hospital. Remember, black is the control. Flatten the curve, sort of flatten the curve. Yeah, don't really quite flatten the curve, but it's better than you might have predicted. So remember on the other image, when we looked at seasonality, if there wasn't a seasonality effect, a 2-week quarantine didn't matter at all. All it really did was delay the inevitable by 2 weeks. If it is seasonal, though, a 2-week quarantine actually has a positive effect. All right, now let's look at what about the 8 weeks. So you have an 8-week quarantine, right, which is what we just went through in Vermont. And we're assuming, once again, that it's seasonal, so it's going to wax and wane. Here's the control. Notice that when you go into quarantine for 8 weeks, you flatten the curve. And remember, in the other figure, as soon as we left quarantine, it came back. Notice it doesn't come back, but when it comes back in the wintertime, it really comes back. You get a second peak that is actually worse than the first one. Now, if we look at the blue line, remember blue line is we did the quarantine kind of well. We flatten the curve and we get a peak, but it's not as bad as the green curve actually. And then red was we did a quarantine, but we only lowered the transmissibility of the R naught by 20%. So you do flatten the curve and you actually don't get a second peak, or I wouldn't say it's negligible, but it's a tiny second peak. Now let's look over here at number of people that end up in critical care versus time. Remember, black is the control. And so green, you flatten the curve, but boom, here's that second outbreak. And notice that second outbreak is actually worse, and you end up with a larger total number of people in critical care than the control. The blue was you did it kind of well, so you flatten the curve, you get a second outbreak, but you still end up with more people in critical care than the control. And here was sort of your lackadaisical quarantine. You kind of flatten the curve, but you don't really have a second peak, but you end up with the same number of people in critical care as the control. So what does all of this mean? So here's what it means to me. All these models, and these models are going to inform our lives, right? These models are how we're going to make decisions on public behavior. And so the understanding how long immunity lasts and whether or not COVID is seasonal are the two critical questions in choosing the right model. And unfortunately, I think, as we all know, these are going to take a little time to figure out, because these are time-based questions. We won't know the answer to the immunity question, well, until that time period has passed. And I don't think we'll know the answer to the seasonality question until we've been through the seasons. Okay, I'm Mark Lubkowitz. That's all I got for you today. I found that really fascinating, trying to let crisis bring out the best in me. And as always, rising from the ashes like the phoenix. See ya.